I didn't think I was going to be hit by it so hard. It's out there, it's happening, and it's spreading very fast.
So we've got 5 patients within this room. We've got a multitude of patients of different levels of acuity, with different levels of multi-organ failure. So basically, we've got them all intubated and ventilated. They're all being monitored. They are all on sort of inotropic support, which is medications to help their blood pressure. And they're also being kept asleep, obviously, with that, to ensure that they're comfortable. There's a few procedures that are happening within the unit themselves, and that's presently occurring as we speak. Patients are being supported with their organs, so like their respiratory functions and their breathing for them. And some of them are sort of having renal support, which is basically helping their kidneys to sort of get rid of toxins, etc. So we have basically put plans in place where we basically are working differently. We're supporting the patients and caring for them very differently. And a lot of that support is coming from other staff members who have been redeployed to help support us. We are concerned that basically if people, the public, don't stay at home and stay indoors and basically adhere to the 3 rules of washing hands, keeping face covered and keeping distance, that it will have an impact on the NHS and ultimately within intensive care as well.
I was just at home self-isolating, and then by the evening I had quite a bad temperature, and then at night time I started getting breathing problems. By Saturday evening I was finding it quite hard to breathe. I rang 111 for advice, and they told me they were going to send the ambulance. I'm okay, I've got the breathing problem, and still my oxygen levels are quite low, so they still keep increasing the oxygen.
Yeah.
I didn't think I was going to be hit by it so hard. I would say, to be safe, to follow all the rules and regulations, and not to take things for granted, and really try to understand the severity of it, because it's out there, it's happening, and it's spreading very fast.